I'm Lisa Allen, and I'm a managing director with Sellers Dorsey's National Consulting Practice. And I also have the pleasure of working with our research and policy team. I lead that team within Sellers Dorsey, and we are working together with ACAP and MHPA on a managed care report. Within my role in Sellers Dorsey, I would say I've been here about 2.5 years, but I come from Pennsylvania state government where I spent about 26 years and was fortunate enough to be part of the managed care implementation in Pennsylvania over that period of time. And so I'm really passionate about the managed care programs in Medicaid, and I know that my two colleagues are as well. So with that, I will turn it over to Craig and let him introduce himself as well.
Well, thank you, Lisa, very much. I'm Craig Kennedy. I'm the president and CEO for the Medicaid Health Plans of America. I have been here for the last several years, but before that, I was with Clinicians for the Underserved and then the National Association of Community Health Centers. But I've been in DC for just over 30 years now, about 20 of that in association world, those 3 associations that I've named. And then before that, I worked on Capitol Hill. My last position on Capitol Hill was I was legislative director for a member of the House Rules Committee. So worked in the House and the Senate on Capitol Hill, and then came over to the Health Association side, and very excited to be at MHPA now.
And Meg, would you like to introduce yourself?
Sure, and thank you for including me. I too have been very involved in Medicaid managed care for a long time. I was a Medicaid director in New Jersey in the late 90s, where we were instituting more managed care. They'd already had it before I got there, but and since 2001, I have been running ACAP, which is the Association for Community Affiliated Plans. And during that time, we've seen tremendous growth in our number of plans, as well as the number of people who are in managed care. So I've been very involved in managed care for a long time from both the state and the plan perspective.
So I think what we want to talk about is the upcoming report that we are collaborating on. And this is really focused on the initial legislative and statutory requirements around Medicaid managed care, stemming from the BBA, the Balanced Budget Act of '97, which really set the framework for expansion of Medicaid managed care across the country. And so together, I think our organizations are partnering to look at both from a state perspective, as well as from a plan perspective, how things have grown over that period of time. So Craig, just a little bit about what your thoughts are in terms of the report and how we're working together.
Well, we're very excited about the report because it's really about the state of Medicaid managed care today, right? It's really about what does it look like today? Where have we been, right? As you pointed out, from 1997 onward, but really, where is managed care today? What's the state of Medicaid managed care? And a little bit how we can look towards the future of managed care as well. Right now, MHPA members are in 40 states, Puerto Rico, the District of Columbia. We serve, as you'll see in the report, managed care covers most of Medicaid today. And so we're very excited to show that impact, show where we are today, but also how we've gotten to this point. A lot of the report will show how we got to this point. And we're looking forward to the future as well of where managed care is headed, although this report will really show the state of Medicaid managed care today. So we're very excited about it, very excited about where managed care is today, but looking forward to the future as well.
And Meg, some of your thoughts about why this is important and who our audience will be for this report.
Sure. As Craig said, it's important, I think, to take a look back. It's been 25 years since the first BBA was passed, and I was involved in that. So for me, this is an important anniversary to mark. But going forward, I think the program, the Medicaid program, is well positioned by having privatized so much of the program through managed care. These private entities have both the creativity and the technology and in the mission to address some of the biggest issues that the program is facing, including addressing inequities, trying to address social determinants of health, improving quality, continuing to be a good fiscal partner with the states as we turn now to this kind of next chapter after the 25th anniversary of the BBA. I think that the states are very well served by having partnered with managed care plans, and we see that because they continue to do it and to address new populations and new services and bring them into the fold in managed care.
Well, I know we are really looking forward to continuing our partnership with both organizations, and the report that's coming will certainly show how managed care enrollment and growth kicked off by the BBA of 97 has resulted in additional transparency, accountability, as well as, I think, Meg, as you mentioned, improvements in innovations and partnerships between both the public and private sector. And so looking forward to the release of the report coming up. And hopefully the audience will find lots of key information as we continue to look at managed care as a driver within continued improvements in the Medicaid program. Thank you both for your time.
Thank you.